I'm Gopal Badlani. I'm professor of urology at Wake Forest Baptist Medical Center. I treat urinary incontinence. Women have urinary leakage, and the incidence of this is quite common. Many of them hesitate to report this because they're ashamed to report it. The leaking can be due to a strong urge to urinate where you can't make it to the bathroom, or when you cough or sneeze or go to lift something that a spurt of urine comes out. Both of these can be treated. Each requires proper diagnosis and requires a different treatment. The urge incontinence is largely treated with medications. In 60 to 70% of patients, you'd get a good response by training their habits, such as fluid drinking, going to the bathroom at appropriate times, and taking medication. 30 to 40% of patients will not respond to this treatment. And a recently approved Botox injection for patients with neurologic conditions can be done simply in the office, and we do that at Baptist. We've had good experience with that as part of trials prior to the approval. And also the use of neuromodulation. This is a pacemaker type of device that can be used to train the bladder better. In very select patients, bladder needs to be made larger. That's a very, very small percentage. On the other hand, stress urinary incontinence once again can be treated with exercise. There are no approved medications for this condition. However, we use some off-label medications for this with some improvement in mild cases. When a woman has significant leaking that is interfering with the quality of her life and she wishes to correct this, this is a simple outpatient surgical procedure where a band of material or patient's own tissue is placed around the urine passage, a new hammock that's placed under the urine passage that supports it and prevents the urine passage from coming down when a person coughs or strains and preventing the leaking. This can make a big difference in a woman's life because she's no longer leaking, not wearing pads, and is much happier once this procedure has been done. And if you ask a successful person, would you recommend that this be done in your friend? And they would say absolutely. And they are my best proponents, going to church, going in the friends group, telling them about this simple surgery that can correct their urinary incontinence.